A very good morning to all the parents, delegates, participants, panelists, and all our dear and near ones. Today, we are here to start off the day 2 of National Summit for Parents of Children with Special Needs. And we have a very impactful and powerful speaker with us today, Ms. Parul Kumtha, madam. She is a pioneer. She's the trustee for Founder for Autism. I am sure everybody has heard her name at least once in their lifetime, who all are attached with the developmental disability field. So, Parul Kumtha, madam, is the proud mother of Kabir, who is a young entrepreneur. Kabir runs his own venture, that is Kabir Creation, since 2018. And Parul madam also helps along with Kabir to other people with developmental disability. Kabir also works in the Encourage Sheltered Workshop since 2010. Kabir is an autistic child. Parul madam has also led foundation of Adult Support Kendra. She has also delivered a TED talk on inclusion, a celebration of diversity. She has also presented so many papers in various conferences. She has attended various conferences like Employment of Persons with Neurodevelopmental Disabilities in the IT Industry, Why a Journey of Autism in India, Parent Support Groups and Their Importance in Tackling Autism, and Facilities for Autism in Mumbai. So today on day 2, we are here. Yesterday on day 1, we discussed most of the challenges of professionals, parents, organizations in current scenario. Today we are here with so many solutions for all of us, and our entire day will be spent on discussing a lot many solutions from various eminent speakers. Over to you, Parul madam. All the best.
Thank you.
And you can start your screen sharing.
I'll do that.
Yeah.
Yeah, can anyone see it?
Yes, ma'am. Yes.
Okay. So firstly, thank you so much, SNIC Rehab Foundation, for calling me to the summit and for allowing me this space. And this is not only a very important topic, the social conscience of organizations and professionals dealing with special needs, but it's also something that is very close to my heart and something that we at Forum for Autism have worked on in various capacities. It's a very important topic because only very recently persons with autism have started speaking up for themselves. And especially in India, all the more. It has just started happening that we have self-advocates, who are speaking about what it is to have autism. And by and large, we parents, professionals, organizations are in charge of or have within our hands and our capacities the future of persons who are vulnerable and who are not in a position to express themselves. So therefore, having a social conscience is extremely, extremely important. Here's what one of our persons with autism, who's a self-advocate, has to say, and why it becomes even more crucial that we have a good social conscience and a good compass on how we represent our group. Because basically what he says is, if you have met one person with autism, you've met one person with autism. So even if you are an expert at having seen 100 people say, there'll be 100 different persons with autism. There is no common, in that sense, knowledge that you can apply completely to a new person. Every new person with autism, you have to relearn about, re-understand about. Now, before we start this whole discussion, I would just like to clear one thing, because there is always this debate on how do you address this group of people. Now, actually, if I was left to myself and with the new knowledge that I have acquired, especially after interacting with persons who have this neurodiversity, I would prefer to have called this group as persons with neurodiversity needing special support. But let's just make it simple for our discussion today. Now, we as neurotypical people tend to look at the person first, person centric style of addressing, and therefore we tend to say person with autism. And this is very important. In fact, I would like to share that one of the first therapists in my and my son's life was a person who made it clear to me. And this is something that stayed with me forever when she said to me that, Parul, you have to remember that your son is first a child and then he has autism. So she made it very clear to me that you have to look at the person first, right? So for a long time, I believed in this person with autism. But when I started interacting with the persons with autism, this is what came to the front. Basically, what they're saying is autism is not an accessory. It's not like a bag we carry in our hand, which we can put aside. It's not that I'm a person and then I'm holding autism with me. Autism is me. I am an autistic person. And therefore, for today's discussion, I just felt it might be a good idea to look at autism and call our group as autistic people. And there is another reason for it. Because when we look at this group as a person with autism being something that can be set aside from the person, we can tend to look at it as in its medical model of disability, right? So, which would mean that there is a possibility of rectifying the autism or treating or curing the autism. And this is also something that we as parents and professionals have seen down the ages, right? In my 20 odd years with my son, I have seen the use of B12 and magnesium, and then, vitamin C and secretin and craniosacral therapy. And of course, now the latest is stem cell therapy and uh, camel milk, etc. Right? But the whole purpose of all of this is that as if there is a person that is hidden within the autism, and if the autism is washed out of that person, the person will emerge. Right? And this is what is called, what the autistic people call ableism. Essentially, making it seem as if the autism is something that is faulty with the person, is something that is wrong with the person. And typically, a medical model tends to look at any disability in that sense. On the other hand, if you look at the person as a whole, an autistic person, a person whose autism is a part of that person's personality and character, then we are looking at it in its social model of the disability, right? Before I go to the next slide, I want to make a point here to mention that this stem cell therapy is an extremely important aspect that needs to be looked at if we are looking at ethics and if we are looking at social conscience. And Forum for Autism, 7 years ago, when this first came on the scene, had held a very intense panel discussion with some of the leading doctors in this field of neuro pediatrics. And, like Dr. Vibha Krishna, to Dr. Brajesh Udani, who's one of your speakers, was also on it. Dr. Anaita Hegde, and also doctors who dealt with stem cell therapy were called on this. And this panel discussion is available on our website, forumforautism.org. So anybody who wants to know more about stem cell therapy, please go there. Frankly, what came out to us as parents through this whole panel discussion was that stem cell is not a therapy, it's a research. It is still in the mode of research, and therefore it cannot be called a therapy or a treatment, right? So let's look at what would happen if you look at the whole any disability as a social model. This is something that a person, autistic person, recently said that I heard, and it stayed with me again. And it was basically talking about impairment that could be within a person, but disability is in the eyes of society. To give you an example, I did not have specs. I didn't use specs until I was 40. And then I had, old age specs, which I started using. And that became an impairment for me, right? But uh, with the spectacles, the augmentation, the disability disappears. However, today, in my group of people, in my strata of society, it is all right to use spectacles, even before you turn 40. If you're a professional, if you're a person who's a graduate or a double graduate, even if you're a girl, yeah, you will very easily land up wearing spectacles right from your school days. But there was a time, and there is a time even now in certain, not so urbanized parts of our country and of the world, or if you look at your parents or grandparents, where for girls to wear spectacles was a very serious impairment. Now, actually, it's the same thing, but it's how society views it, right? If a girl used specs, it was, oh, chashma lagati hai. Or even if a boy used specs, you're, in the arranged marriage market, it made a difference, right? So the impairment, if you're following what I'm saying, the impairment is the same. The augmentation will easily help you overcome it. But if it is viewed as a disability in the eyes of society, it becomes one. And if it is not, it just remains an impairment. The thing is, if disability is, if impairment is viewed as a disability in the eyes of society, it could very well become internalized by the person. So you could have people who have impairment thinking of themselves as not being good enough or being broken and needing to be fixed or being forever obligated for what they're getting. And this is also something that we as parents hold. How do I question a professional? How do I ask whether this is right or wrong? Finally, the person is doing so much for us, right? This is something that we internalize through the process of ableism when we look at something in a medical model, when we look at something in a way that says this is broken, needs to be fixed. Now, I'm just trying to put this out here. What would persons with autism spectrum disorder, what do they experience on a day-to-day basis? And all of us know that these are some of the things that come to mind. Bullying at the hand of peers, even parents and professionals, right? Denial of a choice, denial of a sense of personal agency, being directed all the time, expecting compliance from them all the time, not assuming competence on their part, and essentially creating a sense of exclusion or non-inclusion. And as a result, we all know that some of the outcomes are stress, anxiety, depression, even anger. Now, while the persons with autism are experiencing this set of things, the family's main concerns with autism generally border around the person having obsessive interests or having anger outbursts or repetitive rituals and stimming or what we see as odd behavior. And I'm sure everybody is very familiar with this image. When we focus on behaviors, we are essentially only looking at the tip of what an autistic person might be going through or what that autistic person is experiencing. And the interesting thing is, this same image is an image of ableism because very often this image is used to explain how, when you look at only the behaviors, you're looking at the symptoms, and there is a lot else that needs to be fixed before the behaviors change, right? So the same image can be an image for ableism, but yet it is also an image that says when we look at autistic people, we generally look at them through our convenience, through our understanding, and we're essentially looking at only the tip of what their experiences are all about. In order to explain this better, I have taken the liberty of borrowing from a presentation that I had recently seen, where Emily Lees, who's a speech and language therapist from UK and who's on the spectrum herself, had used this to explain what looking at things in a non-autistic way can lead to. So she had taken the example of social skills training. And generally, when we look at social skills training, we would encourage our autistic people to mask their autism to appear non-autistic. And how would we encourage that? By maybe forcing, urging eye contact, suppressing autistic traits like stimming, hand flapping, etc. You know, the quiet hands, hands in pockets. I myself, with my lack of understanding, have been guilty of this at an earlier stage in life. Yeah. Then teaching social scripting. You know, you should not interrupt. You should listen, read the room, speak in a particular way, have a tone that is in keeping with what is required, right? Basically dictate how people should act and compel compliance, right? So through this vision, we would land up having goals for our autistic people that would be something like respond to teasing from peers appropriately, right? Appropriately could ignore. Yeah, appropriately could mean go and report it to a senior, right? It could mean several of these things. Or we would we would train them to not interrupt others in conversation, even if they have something really important to say. Yeah. Then we would want to help them resolve conflict without abrasive behaviors. This, when you and I are so guilty of abrasive behaviors on a day-to-day basis. Yeah. If we are not understood, we tend to raise our voices. If we are not understood, we tend to throw social tantrums, but we expect complete compliance from autistic people because it is seen as an autistic trait that requires to be normalized. Yeah. Now look at this last thing that is put up. Play appropriately with two peers for minutes. Why? Because that's a goal that we feel is necessary. It may be something that that person, autistic person, is just not interested in, is just not capable of, is something that raises stress levels and anxiety so terribly for that person that it becomes counterproductive. But these are some things that we tend not to focus on because we are not looking at it from the eyes of the autistic person. Let's go back to that earlier slide and re-look at all of these things then. Now, when we set these goals from the eyes of neurotypical professionals, parents, organizations, right? Are we then surprised that the results could be bullying, that they could result in not giving personal agency or expecting complete compliance all the time, assuming lack of competence and resulting in exclusion? And why are we then surprised that stress levels, anxiety, depression, and expression of anger is high in autistic people? Again, borrowing from Emily B's presentation, uh, if you had to set grow neurodiverse goals, right? These are some examples that she gives. So, for example, if you look at verbalizations, any kind of verbalizations, whether they are sounds, inappropriate, non normal, from our point of view, sounds, what is the purpose of the sounds? And explain, expect competence on behalf of our autistic people and explain to them that these verbalizations could have a certain kind of impact on others. Allow these verbalizations, because even if they are not words, even if they are not appropriate in the neurodiverse way, even if they are not normalized, they are still a self advocacy skill. They still indicate request or refusal, yeah, or a way of calling for our attention. Encourage autistic persons to have an opinion and to give that opinion on any topic. I'll just over here give an example to you. My son, from the time he turned 18, has been a voter, and he has voted in every election since, right? A lot of people have asked me about this. Does he understand? Because my son also has intellectual disability in addition to the autism. So I often get questions like, does he really understand who he's voting for? And do you go and vote on his behalf and all of these things? No, I do not vote on his behalf. He decides, right? He decides to the best of his knowledge. Frankly, I always ask back to the people who ask me these questions, how many people really understand who they're voting for? Correct? I mean, all of us are influenced by so many factors when we select who we vote for, and he is no different from that. But he has a right to do it. And because he has been doing it, these elections, we could actually have a little bit of discussion about who are the parties, what are their symbols, what would they stand for, in a way that is understandable to him, right? He has always been a part of any advocacy or protests or anything that have to do with autism. In fact, which year was it? I don't remember. In 2014, 2013, December 31st, all over India, nationwide, there was a candlelight vigil. And the reason for that was that the elections had happened and the government was going to change, and our revised disability law had not been tabled by both houses. Right? So we knew that it would now get delayed further. And we had taken this up, a lot of organizations had taken this up as an issue on the 31st of December and put it down there in the media, saying that while the rest of the world celebrates for autistic organizations and organizations with disability are holding a candlelight vigil because we want this law passed. And it was very imperative for us, the autistic group, to have this law passed because it would mention autism, which the earlier law did not. So, and he's been a part of such things. And all of this is advocacy. All of this is having an opinion. All of this involves talking to autistic persons about things that will influence their lives and what they could do about it. Right? So this, like the next things, having an opportunity to interact with peers in group discussions, etc. Right? Also being able to communicate personal needs. This is also very important, and this can also be done with persons with severe intellectual disability and lack of verbal use through a simple thing like a break card. And I am sure that there will be many other speakers who will be talking about these, uh, supports that can be put in place. So coming back to what I was saying, what do we seek through therapy, right? So again, when we look at therapy from the point of view of normalizing, we essentially could land up looking at either developing the skills and talents of a person for a better future or keeping the person occupied and out of trouble. There is this whole thing that if autistic people are kept occupied, then their autistic behaviors are on the low, right? And it's kind of something that we tend to do when we are looking at the end result being normalizing. And what could normalizing result in? At best, a person with a talent who is then further coaxed to hone it and to become a prodigy, right? The person is like, I often asked, because my son is interested in music, why don't you teach him music? Simply because he doesn't want to learn. Whenever we have asked him, he says, no, I don't want to be formally trained in it. He prefers to listen and sing, but he doesn't want to be formally trained. And I think we should respect him on that. And at worst, we'll have on our hands a person with such low esteem that literally the person has to be bribed to do any activity. And we see this all the time. A lot of parents, professionals saying the person just doesn't have initiative, right? To further illustrate this, I would like to read a poem that I had written a few years ago. And the poem goes, Why You Can't Win With Me. All of these poems, there's a set of 9 poems under the title Why. I thought explain to you a little later. And all of them are based on real life incidents. Is my internet stable? Because I got a notification saying it's unstable. Can you hear me clearly?
Yes,
Yes.
madam. We can
Okay.
hear you.
Yeah.
Yes,
Yeah.
yes.
Okay. So this poem goes, Why You Can't Win With Me. I remember the day I walked into your center with Mama, so well lit and cool and brightly colored. And you said to me, Climb the ladder. I was delighted. It was years since I had climbed any ladder, years since I used play equipment in parks. You see, I'm almost an adult now and 6 feet tall. I approached the freestanding ladder with excitement. 1 rung, 2 rungs, 3 rungs. I have grown since I last did this. There I was, strung out on the 3rd rung, hanging half over the top, my center of gravity wobbling precariously outside my body, marveling at the intervening years that had made this most favorite of my activities challenging to me today. And then you came up to me and said, Come on, go on, right to the top, do it. I looked down at you with a half smile that I hoped said, Surely you're joking. I can't continue, I will fall. But your look was unrelenting. And once more you said, Do it. A big boy like you can. I looked at you once again, hoping my look spoke my thoughts. Oh, but that's the problem, you see. I'm a big boy now, and it appears that I can't climb to the top anymore. It breaks my heart too. Always on cue, my mama, the eternal negotiator, stepped in with attempts to get me to try to do your bidding. Try holding your hand lower, she said. Try putting 1 foot up at a time. Oh, mama, don't you ever get tired of trying to make me accomplish what I believe to be ridiculous and near useless and sometimes dangerous tasks? Oh, mama, mama, don't you realize that no matter how hard we both try, the day is not far when my teachers will tell you that nothing more can be done to teach me? Don't, mama, don't. You deserve better. I do too. And you said to my mama, there is no point in explaining these things to these children. Are you going to keep explaining everything to him all your life? And then you put your hand on my bottom and pushed me up the ladder, leaving me with just two choices: to fall or to jump off. My mama always says that I have good survival instincts. I jumped, and you ran at me and thrust me back onto the ladder with a "do it now." I panicked and pulled back. You yanked at my arm. We struggled. We grappled. A searing pain tore through my shoulder. And before I knew what was happening, you had thrown me down and I was pinned. My face pressed into the floor mat, my hand twisted behind me, and your knee in my back, gasping, not knowing why. My mama said I was held down like a criminal. I felt more like the deer on Nat Geo, breathing his last as the leopard's jaws closed on his jugular. We left soon after. Mama and I, both in a daze. She never took me back. But I learned my lesson from you that day. Nobody can force me to do anything I don't want to anymore. My strength is feared wherever I go. I can always get my way. You can't win with me now. You can't make me do your bidding anymore. Do you know why? My dear, you may be big and you may be strong, but I'm bigger and stronger, and I have age on my side. Unfortunately, this is a story that we see with a lot of young men who get forced into compliance, who are not allowed personal agency, who are not given the time and space to work things out, and whose parents are not listened to. People who know them well, who live 24/7 with them. And while we look at normalization, what could autistic persons possibly expect when they come to us for support, when they come to us for therapy? To belong, to participate, to be appreciated for their efforts, to enjoy the activity, to look forward to it, and to make available for them possibilities to explore new avenues and new experiences, and so much more. So many more such positive things. If we focused on these, the things that autistic people hope to get when they reach out to us, what could be the alternative outcome? At best, a person with a talent who loves the activity and gets better at it because he or she enjoys it, then it could be swimming, it could be math, it could be coding, it could be anything, right? And at worst, a person who indulges in the activity because the process makes him or her feel good, feel appreciated, and gives him or her a sense of belonging. Right? There are so many persons we know who like to perform. So many autistic persons who like to perform because of all the appreciation that they get when they do it. I mean, in fact, all performers, neurotypicals and otherwise, are people who thrive on appreciation. So then the question arises, how do we overcome the barriers that could prevent us from being person centric, where the person is an autistic person? And once again, I try to express it through another poem which was written. And this particular poem, I've been very fortunate that this incident happened in the life of my own son and of me in one of our earliest therapy sessions. Why I reached out to you, why you could help me do it. It was my very first therapy session with you. My teary 3-year-old self curled into a tight ball into the crevices of Mama's lap as though to return to the womb. You had brought a large bag of toys, which you emptied onto the floor near me, while I continued to bawl and push into Mama's lap. I wasn't looking, but I was perceiving your every move anxiously. I remember tensing my body in anticipation, wondering what you would do, relying on my experiences from therapies past, endured against my will until my tantrums forced abrupt ends. She forced me to look at her with her bony fingers grasping at my chin. Will she engulf my hand in her pincer grip and force my fingers to touch something gooey like clay? I was prepared to resist, but you just sat there, running your hands through the toys, asking nothing of me while I cried. I reached for a yellow Lego piece, so you played with some yellow ones. And when I reached for red, you played with red ones. And blue, you played with blue. I saw the pattern. So I reached for two blocks, one red and one blue. And you took two of the same colors as mine. Thump, 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 you said, and slapped your blocks together. I threw mine away at once, suddenly afraid of what you wanted me to do. You let me be. Let me cry. Let me try and return to the wound. You continued to run your hands through the toys, and when your hand magically appeared under my reaching one, holding out a bunch. I took one. Surprised at my own audacity, I slipped off Mama's lap onto the floor next to you, reaching out for more. And you sang my favorite song, my Mama's Lullaby, in your sweet, kind, melodious voice. My eyes jumped to your shining ones. I was pleasantly surprised for the second time in a matter of minutes. How did you know my song? That is when you smiled your warm smile at me and said, "Hi." I jumped back into the crevices of Mama's lap, my 3-year-old self curled into a tight ball as though to return to the womb, and resumed my throaty crying. You let me be. The session ended. I couldn't believe it. I had met someone who understood how difficult it was for me to meet new people, to make eye contact, to take and follow instructions, to try my hand at new things. It made me feel safe, safe in the knowledge that I will not be forced to do things that made me uncomfortable. For the first time, I felt secure to explore my world. There were no hidden agendas. Today, I'm a working man and I take the bus to my workshop. On Saturdays, I hang out with my buddies. We eat out or catch a film or visit neighborhood parks. I help with housework. As I go about my routine, I often remember that first session. I wonder how things would have unfolded if I had not felt secure in the knowledge that you let me bloom at my chosen pace. These are a group of poems under the title if a child with autism question will you care to answer? There are 9 of them, and all of them are based on true incidents shared with me and experienced by me of autistic persons and their families in therapy centers, schools, etc., in Mumbai. And these poems try to explore the possibility of the perspective of the autistic person. I completely understand that I'm limited in my understanding of this. And this was written in a time when very little was available in terms of self advocacy from persons with autism. But this is the link. And if you want to see the other poems, you're free to go. Now, when we look at any service provided to autistic people, what would be some of the things that I would consider non-negotiables and some of the things that autistic people have also shared as non-negotiables for them? Of course, safety, respect and dignity, and agency, self-agency. It should be fun. It should be enjoyable. And there should be a truthful and trusting relation, both with the child, that is the autistic person, and the parent or the family. Now, this is a very important thing, and I need to say this here for any professionals who might be, on this talk. That I remember when my son was 2 and 4 years old, ABA, Applied Behavior, what's the third A? I forget. Was something that was. I'm sorry. Analysis. Yes. Applied behavior analysis was very popular, and the Lova's method was very popular. And it expected you to work 40 hours on a tabletop with your child. And that is something I was really not able to do. Now, fortunately, I had therapists with whom I could share truthfully that it was not possible for me. But so many of my co-parents who went to other therapists often shared this, saying that, I have been asked by the therapist, kitne ghante kiye? And I'll end up saying, I have done 30 hours or 35 hours when I've barely done 5. Right? Now, that's because a parent feels guilty. A parent feels guilty for not being able to do that much and lands up answering out of the fear that if I say I did 5 hours, will I lose this therapist? And it becomes so necessary for us on the professional side of giving the support to understand that each family, each situation is different, has to be negotiated differently. Each person's capacities are different. They have to be negotiated differently. And if that truthfulness and sharing is there, it's only going to help the autistic person. And if it's not there, there's going to be a gap. And we often hear professionals say, I don't know what's the matter, that mother is working so hard, but there seems to be no change, right? Or there is also the feedback that says, I try everything on my side, but the parents are not able to, the mother in particular is not able to carry through. And really, this does not help anybody. So this is something we really need to think about. Of course, if we look at it from the autistic person's point of view, our end aim is very simple. We need to work at making the autistic person feel safe, accepted, and competent. And on these foundations, anything can be built. I would now like to share a PDF. I'll just stop sharing this and go to another. Yeah. Yes. So with the background, what I just shared with you in my PowerPoint, I would like to bring you to this charter of rights that we had put together several years ago when certain incidents came to light in Mumbai of what was happening at therapy centers. And I would credit, I mean, all Forum for Autism core group spent many weekends of very long meetings and discussed these things threadbare. But I would like to give the credit of having worded this to my co-traveler and parent in this journey of autism, Babita Raja. I think she might be on our talk today as I'm doing this. And the wording is, something that she has put down so sharply and so well. So I was reading this through and explaining it, and this is just one example, but it does. This is not what has to be, but this is something that the germ of it is about social conscience and about ethics when we are providing services to the autistic community. So the first thing we said was my child's SOS right, which means which would be I want my way. And here we have said that throughout the document, mother, parent, and legal guardian are interchangeable words. So this is my child's basic right when she or he is in fear or distress and should be complied with immediately. He, she may express it verbally or non-verbally by crying out, pointing to the door, pointing to my photo, etc. I will indicate to the professional my child's preferred way of communicating this right. Other basic rights. My child deserves respect in all circumstances. He, she is a human being first who happens to have autism. My child understands, even if he, she cannot express it. Not talk about him or her in an unpleasant or condescending manner in his or her presence. And this is important, and this is also reflective. And I would like to kind of bring it to the notice also of parents. We often discuss our autistic persons in their presence with others as if they're just furniture. But just because a person does not speak does not mean a person cannot understand body language and person cannot understand what you're saying. So please don't do that. Ask for a separate time with the professional to discuss the child. My child deserves a safe and accommodating learning environment at all times. My child deserves to learn without fear in a non-stressful manner. My child's self-stimulatory and similar needs will not be viewed as rebellious, stubborn behavior and will not be dealt with as disciplinary and control issues. And here, you see, we further defined what that means. So anxiety is known to heighten self-stimulatory behaviors. They subside best when the root cause for anxiety is addressed. Converting these situations into control issues only adds to a child's anxiety. And we have seen this. Yeah, the more you try to quiet hands, the more the stimming and the hand flapping increases. Right? I'll give you another example here. We had placed, through our efforts in Forum for Autism, we had placed one young man in an MNC, and he's a graduate and he's very good with computers, right? So after he was placed there, he was not in customer interface, he was in the back office and he did his job well. But after about 2 weeks or so, we got a SOS call from their team. And I remember I had gone to it, and what I was told was that this person had the habit of rocking very vigorously, and that was worrying to the team. So I remember when we interacted with the team, and I said, "What is worrying exactly about his rocking?" And I was told that we're afraid that he'll hurt himself. So I asked, "Has he hurt himself?" They said, "No, no, no, he's not hurt himself. He's very careful." but he may hurt others in the process. Has he shown any inclination to hurt others? No, no, he's a very gentle person and he doesn't even get up much from his chair, etc. So if the chair breaks and hurts him, you say, okay, let's put the hurt him aside. But if the chair breaks and if the parents agree to replace the chair, so the MNC group immediately said, no, 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 no. I mean, we are a big MNC and you don't have to worry about that. Furniture is breaking all the time. We have maintenance contracts, etc. What is currently there? So then when we looked at this a little more, it came to the fore that essentially when there were deadlines or there was stress or when this person was feeling anxious, he tended to rock more and rock more vigorously. So we then explored what does the rest of the team do when they feel anxious. And one of the things that came out was that they step out for a smoke. And then we asked them, okay, if you step out for a smoke, do you end up smoking more cigarettes when the deadlines are putting more stress on you? And they said yes. I said, okay, so you reduce per day. So somebody said 5, somebody said 10, whatever. So you essentially buy a pack of cigarettes. They said yes. So, okay, a pack of cigarettes on which there is a statutory warning saying it's injurious to your health. So they said yes. So when you go out to smoke, are you surrounded only by smokers or are there non-smokers also with you? He said, well, if we are discussing something with a teammate, the person may come with us. Okay. So essentially, you are being warned that it's injurious to your health, but you're still going ahead with it. You are giving secondary smoke to your colleagues and you're polluting the environment. So whose behavior needs to change? And when we put it like this to them, they immediately understood that this was just his need, his way of addressing his stress. And the minute the team understood it, the team's way of doing this, remember that in our PowerPoint, the slide we had about the society making it a disability. It's just an impairment, and the society, when it views it in a certain way, it becomes a disability. So when the team was calm about the behavior, right, the person felt less stressed, anxiety levels for the person also be reduced, and there was no need for so much of vigorous rocking. However, the team acknowledged that if there is need, the person has complete right to go ahead and rock, just as others in the team had complete right to go out and smoke. Right? So it all depends on how you look at self-stimulatory behavior. If you look at it from our neurotypical normalizing way, it leads in one direction. If you look at it from the point of view of the autistic person, it leads to a completely different end, an end which indicates safety, competence, and acceptance. The next point here is the child deserves to have professionals who are patient with him or her. And then we've defined what being patient means. My child should be given appropriate time to take in sensorial and cognitive inputs in order to perform the expected task, especially a new task. If the task involves some courage on my child's part, like in that poem, climbing a ladder or swinging or swimming or picking up and tasting new food, talking to a stranger, etc., enough time and encouragement should be given to him or her, and I should be consulted. My child will not be bullied, threatened. Oh, okay, before that, my child deserves to be given time to finish most of the tasks himself and herself as best as she can, and patiently assisted and aided to accomplish these better. Right? Again, being patient, we just spoke about. Then, my child will not be bullied, threatened, terrorized, traumatized, abused to perform against his or her will. And we have further defined my child's right to refuse forceful compliance. Professionals do not have the right to pressurize or threaten my child with autism to perform against her or his will, to perform under duress, or rush him or her to perform tasks in order to show results. Just as a regular child will not be forced to do unpleasant and cruel things, for example, eat cockroaches, or a child in a wheelchair will not be asked to run, my child's autism needs to be addressed and accommodated. What may appear as a straightforward and easy task for others may appear life threatening or impossible to him or her. If my child refuses to comply with your command to perform the task, even after your encouragement, then respect his her choice and do not force him her to comply. You may reapproach the task in an alternative, humane manner, and of course, consult me.
Sorry to interrupt, ma'am. We are
Yeah.
out of time, ma'am. We need
Okay, we just quickly finish this. Yeah.
for sure.
Yeah. My child deserves to be treated with kindness. She learns better when taught in humane ways. My child will not be humiliated or given emotional punishments by teachers or professionals. This is further explained of what humiliation could mean. Calling names and all these kind of things, being punished, being separated, being set aside in the class, etc. All of those things that is very familiar with us. My child will not be given corporal punishments, secluded or restrained in the guise of teaching or disciplining him or her or for any other reason. And my child will not be medicated through coercion of his or her family or by teachers and other professionals so that their life becomes easier, except in situations where the family believes that it is necessary, right? And we have also spoken about what is corporal punishment, what is seclusion, and what is restraint. Now, like I was saying, this is something that is something we put down, right? This is not the gospel. This is not the only way of looking at things, but this is a necessary thing to do. And I would urge all organizations and all professionals and all families to put down what are the non-negotiables and what are the good practices for them as a group, as an individual. This was just some of the things I wanted to share today. With this, I can stop the presentation and I would be happy to take any questions or feedback.
Thank you, Parul Madam, for your wonderful insights. Those were really eye-openers. The way you displayed the perspective of an autistic child along with the perspective of the society, the comparison of the social model along with the medical model was wonderful. I could definitely correlate to it, even although as a professional, I'm sure that each and every parent were able to pen down each and everything and able to correlate. Also, the poems, we could see Kabir in your eyes during those poems. So those were very nice personal experiences you had shared with us. And I'm sure that this was a very fruitful presentation for all the organizations and professionals who are dealing with children with special needs. And this will go a very long way ahead. Also, your presentation was wonderful. Yeah, that is what the comments we are receiving in the comments box. Thank you so much, Parul Madam, for your entire time, for your entire talk. And although you are not well, but still you stayed with us with your compassion. We could go ahead, and your guidance will always be very beneficial for all the parents in this community, ma'am. Thank you, Parul Madam.
Thank you. Thank you. I'm just saying some people are asking for a PDF. If the PDF is shareable and you have it, so if you want to put it into the question answer or chat box so that everybody gets it.
Yes, yes,
good.
yes. Harshali Madam will be able to send it to the parents.
Yes, I will post it in a group. And Mary ma'am is here, so yeah. Okay, she left. Okay, Mary ma'am was here.
Yeah, I know. Yes. Yeah.
Okay, fine.
Yeah.
Yeah. So, ma'am, we are just running out of time, so I
Yes.
won't take any questions as of now.
Yeah,
And
sure.
I've just shortened my briefing also. Thank you so much, ma'am. Thank you once again.
Thank you. Thank you for having me here.
Have a wonderful day, ma'am. Thank you
You
so
too.
much.
Thank you.
Thank you.
Yeah.
Thank you,
Thank you.
Parul.
Yeah.